The broadcast is now starting. All attendees are in listen-only mode.
Good morning. Thanks for joining us today for our webinar. My name is Carmen Boone. I'm an education coordinator from Oregon Pacific Area Health Education Center. We're a hosted agency of Samaritan Lemadon Community Hospital. Our agency mission is to promote access to quality health care through community and educational partnerships. And today, I will be your host and moderator. Let's go over some housekeeping items first. You will notice that all microphones are in listen mode only. They'll remain muted during this session. Please use the questions menu and type your questions and comments at any time. We will be monitoring them throughout the presentation. The slides can be downloaded from the handouts menu. If you have any trouble downloading them, send us an email and we'll help you. This webinar is being recorded and will be available on our YouTube channel. If you have any questions, please send me an email at carmenb@samhealth.org. To obtain CME or CE credit or a certificate of attendance, you must log in to www.eeds.com and enter this activity code. Please write it down for your records. And please consider that the activity code expires in 1 week. We will email you these instructions and links today after the webinar. This presentation is jointly provided by Samaritan Health Services and Oregon Pacific Area Health Education Center. The presenters and the planners of this activity report that we have no conflicts of interest or relevant financial relationships with any commercial entities that might affect the contents of this presentation. This webinar is presented by Beck Fox. Beck is a trans non-binary program director, advocate, and community organizer with a focus on queer trans health equity issues. They graduated from Eastern Washington University with a master's degree in clinical psychology. After moving to the Oregon coast, they worked as a mental health therapist at the Olalla Center, a Lincoln County nonprofit organization. The lack of resources, support, and acceptance of LGBTQ+ youth in the community spurred the creation of Bravery, an Olalla program for LGBTQ+ youth and young adults. Bravery seeks to empower, advocate for, and inspire bravery within our LGBTQ+ community through addressing health inequities, providing safe space, social connection opportunities for youth leadership, and help assessing affirming resources. In their off time, Beck enjoys painting, gardening, and spending time with their partner of 16 years, their dog, 4 cats, and 3 goats. Now, without further ado, I'm pleased to leave you with Beck.
Thank you, Carmen. Hello, everyone, and thank you very much for being here today. I will note really quickly that, as many rural Oregonians do, I am experiencing some unstable internet connection issues. So I hope everybody can hear me. And Carmen, please feel free to chime in at any time if I cut out or my audio gets a bit garbled. All right, next slide. Just a teeny bit more about me. Carmen did a really wonderful job introducing me. So I identify as queer and trans. I direct the Bravery program at Olalla. My background is in clinical psych. I also am the board chair of Oregon Central Coast PFLAG and pretty well connected to all the LGBTQ+ happenings around the Central Oregon coast. my work draws really heavily on my lived experience. I am not a self-proclaimed expert when it comes to trans issues, but definitely my lived experience does provide a lot of really valuable context for what we're going to be talking about today. Next slide, please. So the pandemic has had a disproportionate impact within many marginalized communities, including the trans community. And the question that we're going to be talking about today is, how has this impact shown up within mental health specifically? Next. Before we begin, I wanted to spend some time laying a bit of groundwork. For some of you, this may be like a repeat of information or a refresher on some information, but I feel like it's really important before we dive into really talking about this to establish some common understanding and make sure that everybody is on the same page so that we can have a meaningful discussion and that you can really understand this information. Next. So the key concepts in this section that we are going to be talking about are the differences between sex, gender, and sexuality, transgender and cisgender, what do those terms mean, gender identity and gender expression, a bit about language and pronouns, the trans umbrella, what does that mean, and what does that look like, the diversity of trans identities, and a bit about health disparities as well. And these points should help, again, kind of lay like this common groundwork so that the rest of the presentation and information will make more sense and hopefully be more meaningful. Next. So what is sex? When a baby is born, people use visual criteria such as primary sex characteristics to make a determination of the baby's sex. It is important to note that, quote, biological sex is not binary. Intersex people, for example, are born with a diverse combination of sex characteristics. This is an assignment that is based entirely on external perceptions of a person. Gender, on the other hand, is an internal perception of self. This is how you feel about your own sense of gender identity on a deeply personal, inside level. Your gender is not determined by your sex assigned at birth. Sexuality, which is comprised of romantic and or sexual attraction, or neither, is a facet of a person's identity. It is a distinctly separate construct from both sex and gender. In other words, a person's sexuality or their orientation exists independent from their sex assigned at birth or their internal perception of their own gender. It does not have a bearing on gender does not have a bearing on sexual orientation. And a person's sexuality cannot be inferred from either their sex assigned at birth or their gender identity. That being said, it's important to note that these domains may feel closely linked for some individuals. We're all different. We experience our bodies and our identities and our hearts in completely different and unique ways. Next slide. So transgender, what does this term mean? A transgender person is a person for whose their gender identity, again, that internal perception of themselves, does not align with the sex that they were assigned at birth. Often this is shortened to just trans. On the other hand, a cisgender person is someone whose gender identity does align with their sex assigned at birth, and this is often shortened to cis. So for example, a person who was assigned male at birth but has a gender identity of female is transgender, a trans woman. A person who was assigned female at birth and has a gender identity of female is cisgender, or a cisgender woman. Next. Really quickly, a little bit about the differences between identity and expression. So gender identity is that internal sense of your gender, how you feel about yourself. Your expression, on the other hand, your gender expression is how someone outwardly expresses their gender. This can be through things like clothing, general appearance, and behavior. Next. I wanted to touch on language and pronouns just briefly, because this is something that comes up a lot when I give trainings and talk to parents and families that have LGBTQ+ kids. is how to handle the seemingly ever-changing language, and especially pronouns. So why are pronouns so important? Pronouns are tied to self-identity, your self-expression, and the way that every single person moves through the world. When you use someone's correct pronouns, it is a really quick and easy way to show inclusivity and respect for that individual. Being misgendered, which is when the incorrect pronouns are used, can often create feelings of discomfort and distress for trans people. And so whenever you have the opportunity, normalize sharing pronouns. And there's lots of ways that you can do that. But the more that this process becomes part of our everyday life, the more inclusive and respectful our spaces become. It's really important to note that the painful feelings that do come up from being misgendered can occur even when that misgendering is not malicious. If you catch yourself using the wrong pronouns for somebody, which does happen, I am a trans person and I mess up talking about some of my trans friends. It does happen. The best thing to do is just correct yourself, offer a brief apology, and move on. The more you use the correct pronouns for that person, the more second nature it will become. And like I said, when it comes to normalizing pronouns, there's lots of ways that we can do that. You can put them in your email signature, your social media bio, add them to a name tag, get like a little pronoun pin for your badge or your lanyard at work. When cisgender people, that is, again, people who identify with the sex they were assigned at birth, take the initiative to share pronouns and make it part of everyday social and professional practices, this helps take some of the burden off of trans people who are often put in the position of bearing the emotional labor to explain this again and again and again. Next. Be mindful of the ways that the words you use might reinforce the gender binary. So do kind of a quick little self-check on the kind of maybe everyday common language that you use that you might not think about being overly gendered, but that might be not the most inclusive way when you talk to a group of people. So things like you guys or ladies and gentlemen, consider the ways that might enforce the gender binary instead of being more inclusive to diverse gender identities. And be sure that you are also using the correct language when you refer to transgender people. Saying something like he is a transgender or she is a transgender is incorrect, whereas he is transgender or she is transgender would be the correct way to say that. Next. Consider the ways that your administrative or clinical environment might be reinforcing the gender binary. So take some time internally to think about things like, what does your paperwork look like? What questions are asked by your administrative and clinical staff? What does your bathroom access look like? Really take the time to walk through from the front door all the way through the experience of your community members, clients, patients, whoever might be coming into your space. Really take the time to kind of tour your entire facility, building, and administrative process, and think about how that binary might be being reinforced and where could you make an effort to be more inclusive. Next slide. What is the trans umbrella? The trans umbrella is kind of a metaphor for the vast diversity of trans identities. Some, but not all, transgender people fall within the binary. So trans men and trans women have binary identities. The trans community also, though, includes non-binary people and a wide range of other gender diverse, gender expansive, and gender non-conforming identities. Next slide. And for you visual people like me, this is just a really colorful, kind of cool way to conceptualize what the trans umbrella is. So that overarching big umbrella is transgender, and underneath that are binary trans identities and non-binary trans identities. These are not an exhaustive list. There are many, many, many different, diverse, really cool different identities that people have. But this is kind of a neat representation to just sort of get a picture of what that means. Next slide. It's important to remember that trans identities are unique. When we talk about trans people, bear in mind there is no one way to be trans. There is no trans experience, quote unquote. People can transition at any age, whether that's 3, 30, or 95. It doesn't matter how old somebody is. That being said, too, people often go through transition, but some don't. Transition can include medical transition. hormone replacement therapy, gender-affirming surgical procedures. Medical transition is something that is done in close collaboration with a medical team, whereas social transition can involve things like changing a name, pronouns, or physical appearance, and sharing that with other people in the world. Remember that just as trans people are unique, so is each and every transition process. And being able to go through that process and live authentically is deeply, deeply affirming and quite often literally life-saving for many trans people. Next. I did want to note just after that last slide that despite the growing media movement around high rates of detransition, which means someone that transitioned, for example, from male assigned at birth to female, so a trans woman, detransition would be that trans woman chooses to detransition back to the gender assigned at birth, which would be male. Despite the kind of growing attention about this being a rampant problem among the trans community, a 2015 study from the National Center for Trans Equality found that only 0.4% of their nearly 30,000 participants surveyed detransitioned after deciding it was not the right decision for them. So it is incredibly, incredibly, incredibly rare. Next slide. In order to talk about COVID a bit later here, it's really important to touch on the existing health disparities faced by the transgender community. And I'm just going to run through these really, really quickly. There are lots of them. Trans people are more likely to be unhoused or have been unhoused at some point, more likely to be unemployed, less likely to have insurance, less likely to have access to competent affirming care, far more likely to be denied care altogether, whether that is in an ambulance, in the ER, from a primary care doctor. No matter what the service is, they're more likely to be denied entirely. Trans people also struggle with higher rates of substance abuse, depression and anxiety, self-harm and attempted suicide, and are much more likely to face harassment, discrimination, and violence. Next. The trans population has a suicide attempt rate of 8 times that of the general population. And it is really scary to think about, and it's very, very sad, but I'd like to include this because it really helps provide context for the incredible amount of struggles and barriers that already exist for the trans community. Next slide. Here's a couple of statistics dealing with the trans community, and I'll let you kind of read through those. They're very stark, they're very alarming, and really what I would hope that folks take away from this is the crisis that these numbers represent is not due to the nature of being transgender. Just because a person is trans does not mean that they are in crisis all the time. It does not mean they are going to have mental health issues. All of this is due to the systemic discrimination and violence against trans people that is really deeply built and integrated into our culture. It is because of that trans people are often in crisis. It is not due to the nature of being trans at all. Next slide. All right, so COVID-19. Next. How has the pandemic impacted this population that, as we've just seen, already faced significant inequities? Next. We're going to talk about this in 2 ways. So COVID-19 in the trans community and problems with data gathering, and then also talking specifically about the impact of the pandemic on mental health. Next. So talking a bit about data and the binary sex bias. So when doing the research specifically for this presentation, it really came to my attention that there were crucial gaps in the existing data around COVID-19 in the trans community. Public health data often only relies on binary sex, male and female, and that is not able to capture an accurate picture of what's going on within intersex and gender diverse populations, and it's not able to speak to the health outcomes of those communities in the wake of situations like this. There's also generally a lack of nuance in gathering data around gender identity, and conflating sex with gender and the ways in which that erases trans identities. Often we also see that data gathering in public health tends to impose this sort of heteronormative and cisnormative. So that is the assumption that heterosexuality and being cisgender is the norm, and somehow a standard. How imposing that lens fuels stigma and exclusion against marginalized communities, and in this case, specifically the transgender community. In general, data around rates of COVID are pretty unclear within the trans population specifically. The CDC did come out and put out some statistics on the LGBTQ+ community more broadly, but it's really difficult to track down clear data around trans and gender diverse people because generally that data just wasn't gathered. However, there are some exceptions to this. When I was looking through the research, the Harvard Gender Sci Lab noted that some individual localities implemented inclusive data gathering practices. Oregon, so go Oregon, and Massachusetts are the only two states to have included non-binary in their data gathering around COVID. I will note specifically for those perhaps that live or practice in the areas that notably Lane and Wheeler counties were identified as standing out for their particularly inclusive data gathering practices. So excellent work there. In terms of across the board in the United States, Rhode Island was identified as having the most comprehensively inclusive data collection practices around sex and gender identity. So while it's important to kind of give kudos to this couple of states and then the specific couple of localities across the country maybe that did have some inclusive data gathering practices, when you think about, there's 50 states, and to be able to name 3 that made an attempt to include trans and gender diverse people in their COVID-19 data gathering practices. It's pretty disappointing, and just highlights the fact that there's a lot that we don't know about how this pandemic impacted that community in terms of like having cold hard data to look at. Next slide, please. So research has suggested that trans and other gender diverse people face higher risk of having chronic health conditions in the first place. And these include things like cardiovascular disease, cancer, and other health behaviors such as smoking. All of these factors, as we know, increase somebody's risk for contracting and going on to develop more serious COVID-19 and potentially dying from COVID-19. The trans community is also disproportionately impacted by HIV, which compromises the immune system and thereby presents a significant increase in COVID-19 risk. Trans people are also statistically more likely to be unhoused than the cisgender population, more likely to be unemployed or live in poverty. And trans people may have faced more significant housing and food insecurity during the pandemic. I did want to point out that for unhoused trans people in particular, accessing critical resources at a shelter, for example, is not necessarily an option. And this is not something that people always think about. But many shelters in our country are segregated by sex. And trans people risk being harassed, assaulted, kicked out, or denied shelter altogether. And sometimes may choose to live on the streets instead of accessing services at a shelter to avoid these kinds of situations, which in some cases, aside from being deeply, exclusionary practices and hurtful and invalidating, can sometimes be downright dangerous or deadly. I remember that just a couple of years ago, and this is not an isolated case, this happens, that a trans woman who was seeking shelter, this is not here in Oregon, but was denied shelter during the winter and froze to death. And tragically, that kind of thing happens. And it just highlights the lack of access that trans people have to really, really critical resources needed to live. And similarly, that also extends not just to shelter, but those important resources like healthcare. So trans people, due to repeated negative experiences within the healthcare system, may not even seek care if they have COVID systems. Some trans people, just because of the continued discrimination, harassment, or denial of care, misgendering, refusing to have their records marked correctly, may avoid general care until symptoms are intolerable, and that also could be translated to COVID-19 symptoms, which may lead to poorer health outcomes as well. Next slide. Trans and gender diverse people who rely on sex work for survival may have been unable during the pandemic to advocate for safety practices such as social distancing. Obviously, that would be very difficult in that position, and thereby those folks are also at a much more increased risk for COVID-19. Undocumented trans and gender diverse people may be more likely to work in what we have deemed essential jobs, such as farm work, and unable to work from home, like many of us have been very, very privileged to be able to do. Members of this community often also lack access to health insurance and healthcare services. And so even if something is going wrong and they have COVID-19 symptoms, they may not be able to access or afford care. And there's also the risk and fear of deportation, stigma, harassment for being undocumented as well. In general, these folks are just much more at risk. For people of color in general that are part of the trans and gender diverse community, the statistics have shown that they are at higher risk of contracting and being hospitalized and dying from COVID-19. And this is due to the intersecting experiences of both transphobia and racism. So this is highlighting the real critical importance of intersecting identities and the ways that these disparities, it's not like you just get one, they compound upon each other. Next slide. So even though there are significant gaps in the data, it's not a whole lot to draw upon. There is enough evidence to suggest that the conditions that were created by the COVID-19 pandemic amplified existing inequities and have contributed directly to poorer health outcomes for the trans community. The pandemic has highlighted the importance, like I said, of intersectionality, both in data gathering and analysis, because if we don't look at all these facets of a person's identity and look at them together, we're not going to get a complete picture. You are dealing with it's an incomplete picture of what's going on for these communities and erasing parts of their identities. So in order to fully understand how this pandemic has in fact impacted trans and gender diverse communities, we really have to look at how the role of social, economic, and historic inequities in driving these disparities, all of that has to be brought to light. So that's why there's kind of this long buildup to talking specifically even about the mental health piece, because it's not like the COVID-19 pandemic started, in very, very late 2019 into early 2020, and all of a sudden there were all these health disparities within the trans community. You really have to go back and look at the history, this very long history of marginalization, discrimination, and violence towards this population to really and truly understand how we got here and how the pandemic exacerbated those disparities. So you have to really take everything in context and look at the bigger picture instead of taking that narrow lens of just looking at the effects of COVID-19. Next slide. So how has COVID impacted mental health specifically, because so far we've talked about, the disparities faced by the trans community and the ways in which those may have contributed to poor physical health outcomes in terms of higher rates of contracting COVID, being hospitalized, and for some even dying of COVID. So that's the physical health side, but how has it impacted mental health? And really, like I said, it's more like the pandemic in this regard just cranked the volume to 11, so to speak. Like it really just turned up the dial and turned it up hard. So some of the impacts in this domain that have occurred are interruption and delays around gender affirming care. We saw this with the cancellation of elective procedures during the height of the pandemic, when procedures that were deemed unnecessary were rescheduled and rescheduled and rescheduled, or canceled entirely with kind of no clear end in sight to when that might happen. For trans people, gender affirming care is inextricably linked with mental health. So we're not talking about elective procedures being necessarily the same as, oh, and I'm going to have to try to think of an example that's not really silly, but elective procedures like if I needed a cosmetic removal of something that did not directly impact my health, but would just be a strictly cosmetic procedure. That is not the same context and setting when we're talking about a transgender person who needs a gender affirming procedure, such as top surgery, bottom surgery, or anything else that has a really dramatic impact on their mental health and well-being. I know for many trans people, even here in my community in Oregon, as people were talking during the pandemic, the devastation caused by getting cancellation notices for consultation appointments, surgery, it was horrifically devastating for people. There were people who were just very, very vulnerably and openly communicating to our community that, this was their lifeline. This has been the thing that's kept them holding on, that they had a surgery date or they had their consultation date, which already outside of the pandemic can take months and months and months on a wait list. And that was the one thing that was their hope. And to have that canceled on top of the stressors of being in the midst of a global pandemic was really, really devastating and difficult for some people. And there were moments, watching things kind of unfold on public forums or private groups like on Facebook that, you worried about people because you could see how devastating and terrifying this was for them to have this critical care rescheduled, taken away, and not knowing when it would happen again. And there's studies too to back that up, that accessing that gender affirming care does have an impact on mental health, and it can literally be the difference between life and death. So for somebody that has been waiting and waiting and waiting for this kind of procedure, I can only imagine how that must have felt to have that taken away. It's I think illustrated too that as of last summer, even before like the really big wave of COVID hit the US in winter, calls to the Trans Lifeline, which is a national hotline that a person can call 24/7, calls jumped 40%. And ever since have really not showed that much sign of slowing down. And 1 in 7 of those crisis calls were specifically related to medical care and being unable at the time to access the gender affirming care that they need. The economy also has presented its own set of stressors, as many of us are aware. It just hasn't helped. Lack of jobs due to pandemic closures. This resulted in loss of income for lots of folks, sometimes loss of health insurance, access for medical care, and all of these factors placed increased psychological distress on a group of people that already have really high rates of depression, anxiety, and suicide attempts. So these stressors definitely didn't help. Also, lack of access to mental health care. As many services moved online, as much as I really have grown to love telehealth, I think it's in some ways so amazing in terms of access. Many trans people, though, found themselves without access to care. Because many trans people are more likely to live in poverty or be unhoused, relying on access to technology for mental health care became a serious barrier for a lot of people. And I saw this happen within my own community and some of the youth that I work with, particularly in rural areas. Reliable internet, and this is something that I deal with every single day, but for so many people, reliable internet connection is difficult to come by, and so like accessing telehealth appointments is really difficult or impossible sometimes. Also, for those without insurance and unable to pay out of pocket, cost of care has been prohibitive. And further, the number of mental health providers that even offer like affirming and competent care when working with trans individuals is incredibly small. And we noticed here in the community, and I'm sure this also translated more broadly, waitlists just started to grow, and being able to get into care was really difficult for a lot of people, especially for those that live in rural communities where they may not have any access to a provider that is competent in specifically trans issues and trans care. Another really big and devastating challenge presented by the pandemic was a product of social distancing and the creation of isolation, being cut off from community connection and resources. This could be a lack of safe spaces where a trans person's identity is affirmed, and then specifically some unique challenges faced by trans youth. So isolation has always presented, has always been a problem for a population that does not have that many safe spaces, often doesn't have that many resources or supports. Crisis counselors have reported that trans folks have called in struggling with being, for example, like forced to quarantine with a partner or their family that may be unsupportive of their identity, or in some cases are even abusive towards them, but they're trapped in that situation because of having to quarantine and not able to get out. For trans youth in particular, who because of their age, being minors, really have no other option than to quarantine at home, mental health became an even bigger problem than it already was. Unsupportive parents and family, lack of social opportunities with their peers, lack of access to any kind of community, all contributed to a sharp spike in mental health related concerns in trans youth. It's also really, really scary and sobering to note that during the pandemic, homicides against trans people also skyrocketed. In the first half of 2020 alone, the number of homicides was 26. The total for the year prior in 2019 was 27. Next slide, please. This is a graphic pulled from the Washington Post's article on crisis calls to Trans Lifeline and how those have spiked during the pandemic. And this is definitely something that in my work I experienced and watched unfold in trans community groups across the state of Oregon, is the number of folks in crisis definitely took a tick upwards, a really strong tick upwards during the pandemic. Next slide. I wanted to speak a little bit more about trans youth in particular, and how the pandemic presented unique mental health challenges for this especially vulnerable sort of subpopulation of the trans community. An LGBTQ+ youth organization in New York reported that their youth were asking for more frequent counseling appointments, and that they made a third more referrals for initial psychiatric services compared to the same period of time in 2019. So clearly the pandemic, it's been hard for everybody. It was hard for the trans community in general, but for these kids, it was really, really rough. A little bit more context on just some sort of the disparities that these kiddos face. LGBTQ+ youth in general make up a disproportionate number of youth in foster care and group homes, where staff are often ill-equipped to meet the needs of this population. And this graphic to the right is something that I like to include almost no matter what I'm talking about in regards to LGBTQ plus or trans youth, is that whereas like you're looking at a 5% general youth population, 40% of the youth homeless population are LGBTQ plus, which is absolutely striking to me and really highlights the bad way that these kids were in to begin with. And so you strip them of access to community, safe spaces, affirming resources, and it really is a recipe for disaster for these kids. Next slide. Oh, I think you skipped early one back. There we go. So what was it like to be disconnected from connection to critical social supports? And that is still continuing. Many social supports have not gone back to in-person services yet. So for many people, the only means of accessing some of these supports is still online. So for many trans people, access and connection to supportive relationships and other social supports literally create some of the strongest protective factors against suicidality. There's a statistic out there that says that just a single supportive adult in the life of an LGBTQ plus youth can reduce their chance of attempting suicide by 40%. And every single time you add another supportive adult to that, that number continues to improve. So their chances of attempting suicide get smaller and smaller and smaller the more supportive adults you surround this kiddo with. But just one, that could be a parent, that could be an aunt, an uncle, a teacher, a scout leader, a coach, doesn't matter what role that person plays necessarily, but just that one person being supportive can reduce their chances of attempting suicide. And so you can imagine if that youth no longer has access to that person while they are isolating, while they're in quarantine, perhaps with an unsupportive or abusive family, that risk jumping back up. Social connection in general for the trans community has been shown to buffer against the impacts of stress, reduce depression, and improve overall well-being. The Trans Lifeline reported 1 in 4 of their crisis calls during the pandemic was about lack of connection to community. And that's something that I've seen here within our local community a lot, is even though we've had the Zoom meetings and we've done everything we can to stay connected with people, that it's not the same, and there's still not that ability to kind of lean on one another and be in community and have that really safe space that you build together. And for those people for whom community is their biggest protective factor, it was really scary for them to be isolated and to be cut off from the only people in their lives that they felt safe with and they felt supported by. Next slide. Like I said, these kids already face increased risk of rejection, discrimination, victimization, and this pandemic has only further compounded all of those risk factors. Again, being isolated at home with unsupportive families, these family members may refuse to use their correct name, their correct pronouns. There may be harassment or abuse. Being disconnected from support networks can be very dangerous for these youth because the struggles become invisible to the public. When teachers aren't able to see their students and connect and check in if they think that something might be wrong, the isolation can really create a dangerous situation where nobody knows that the youth is in trouble. It's also just kind of a part of being a teenager, and especially for trans teens and teens that are exploring identity and are already marginalized and have like these kind of stacked up risk factors. But connection and needing to belong are just super important for teenagers and really important for trans kids. And again, that lack of access to technology, some of these kids were not even able to access virtual supports. And so again, we're just completely cut off for going on, a year and a half now. Next slide. Nope, other way. One more. Perfect. So kind of the takeaways from this section is that the pandemic, COVID-19, in and of itself, did not create a mental health crisis within the trans population. It exacerbated an existing crisis, as it has in many other ways. This pandemic has really put a bright spotlight on the glaring gaps and the inequities in our healthcare system when it comes to our most marginalized and vulnerable communities. We have seen this pretty much across the board with marginalized communities, communities of color, immigrant, migrant communities. Like we have really had to look at the ways in which our system fails people. And the same goes with the trans community. These problems were not created when COVID came to the US. They were not created when the lockdown orders came. These problems have been there. They just got uglier. Trans people, and this is really, really, I think, important for providing that kind of like emotional context. Trans people fight every single day for their lives. And the pandemic made that fight harder. For some people, it was not a fight they could continue. And for other people, their opportunity to thrive and to grow and to shine as their authentic selves was completely taken away from them. I talked very briefly about homicide rates in just the first 6 months of 2020, almost surpassing the entire year of 2019. 2021 is on pace to be the deadliest year for the trans community. We have already passed this point last year. Next slide. So what can we do? There are plenty of opportunities for action. I don't want anybody to be left feeling hopeless and like, well, all this is terrible, terrible, terrible. How can I help? If you are part of an agency, you might consider some of these. So how can you increase representation in your leadership? How are trans people represented? Are trans voices at the table? Are trans people involved in decision making? How can you partner with trans-led programs and organizations? You might consider also reevaluating policies and practices that may perhaps inadvertently harm or exclude trans people. Consider if your place of business or your place of service is welcoming and safe. And I will note here that putting like a pride flag sticker in your window or something is a cool visual cue, but it goes so much deeper than that. And just putting that little safe space sticker or poster on your door or on your office window or whatever it is, that's great, but it has to be backed up by meaningful action. Everybody on your team has to understand what it means to be a safe person in a safe space, and there has to be follow through on that. You also might consider investing in really solid equity resources, such as bringing in training for your staff. If you don't have a DEI committee, consider creating one and inviting, though not expecting, inviting LGBTQ+ people to be a part of that work so that their voices are being heard. Also, how can you increase access to your services for trans people? Access to care is a huge issue for the trans community. So considering the ways that you can start to bridge some of those gaps and make them more accessible. Would you be able, for example, to offer like a technology like scholarship program or like library loan kind of program if someone doesn't have access to a smartphone or a tablet or computer to access telehealth care or anything like that? Also consider how does your data gathering look? We've seen the huge gaps in data around trans and gender diverse people nationwide when it comes to just COVID. So most of our agencies gather data. What are your data gathering practices? Do you gather data on gender identity? If you do, how do you ask those questions? Is it done in a sensitive and inclusive way? And how can, very importantly, how can you use that data to improve your services, improve access, and improve client and patient outcomes? Because it's really great and fantastic to gather all that data, but if you don't do anything with it, it's pretty useless. Next slide. If you are a provider, you might consider donating to or volunteering with programs and organizations that serve trans people, and using your position and your voice to advocate for your patients and clients. Many of us are in a position of privilege where we have a platform, we have connections and networks and resources and time and all that kind of stuff that we really have the ability to advocate for people, and that's something that we should be doing. If you have an opportunity to take a stand against something, speak up, intervene, help get somebody connected to what they need when they keep getting told no, or dismissed or invalidated or harmed. How can you stand up, and how can you use your privilege in a positive way? Also, invest your time in continuing education around trans issues. Like, I am beyond grateful that each and every single person is here today for this 1 hour training. But it's kind of like, 1 hour once a year is not going to make you an expert, right? Learning is a continuing journey. Be humble, acknowledge that it's a lifelong process. And as things continue to grow and evolve and change, and new data comes out and new studies and language keeps changing and evolving, like, I have to keep learning all the time, and I'm part of this community. And so just acknowledge that in order to really better serve the trans community and support the trans community, it does require an investment of time and energy on your part to keep learning and really show your commitment to being open and continuing to learn. So self-education. Don't rely just on trans people to bear the burden of explaining and educating. I love doing it. It's my job. I think it's fantastic. But for most trans people in their day-to-day lives, they get asked questions like, what are they, them pronouns? Why are they important? Why do I have to use them? What is this, that, and the other surgery? Explain to me what all the letters of the acronym mean. And the list goes on and on and on. And when those questions happen day after day, over and over and over again in all of your encounters, it is exhausting. And so in order to kind of help relieve that emotional burden of explaining and educating, I sometimes feel a little bit silly when I say it, but my #1 recommendation, Google it. Like, Google is a tremendous resource. We've got a giant resource right in our pocket or our bag or whatever. Pull out your phone, Google stuff, and there are some excellent resources out there. Again, be mindful of using gendered language. It can be really easy to slip into the habit of saying things that are kind of like colloquial language. Like, I grew up saying, hey, you guys, and hey, dude, and stuff like that here in the Pacific Northwest. And it has taken a bit of brain training on my part to be mindful of using that language. Brains are amazing. They are totally capable of learning new skills. And so developing that mindfulness and self-awareness takes some time, but it's totally possible. And it'll just help you make your language more inclusive and make you a safer, more welcoming person, make the space that you're in more safe and welcoming for trans and gender diverse people. Also, be knowledgeable of your local resources so that you can easily refer trans patients, clients, or community members coming to you to affirming providers, social supports, or other resources. So if you can't help somebody with what they're looking for, whether that's like, they're coming in looking for hormone replacement therapy or, mental health counseling specific to trans issues, or a referral for like a social support group or anything like that, just know what's out there so that if you don't have that in-house, you have a list on hand that you can be like, I can't help you, but I know who can. So definitely developing awareness of what's out there in your network, in your region. And there's also some really great national resources, and we'll get to that in just a second, that you can refer people to. Next slide. And this is not a comprehensive list of resources, but I did want to leave you with some, and these should all be in the PDF file that you can download also. So on the left in that column, these are all national resources. Trevor Project is probably like the single biggest, most well-known LGBTQ+ resource that's got 24/7 hotline support, a really wonderful crisis staff, resources for self-education, resources for queer and trans people that are like, how do I deal with coming out? How do I deal with my family? Like, they are an absolutely wonderful resource. Trans Lifeline, again, from which I drew quite a number of my statistics, is a 24/7 trans hotline that somebody can call if they're in crisis. Some of these are strictly educational. Some of them are advocacy organizations, but all of them are super well vetted and recommended, and anybody in the country can access those as long as they have access to a phone or a computer. The middle column and the right-hand column are all Oregon-specific resources, some of which are Portland Metro, some are Willamette Valley, some are here on the coast, and there's even a couple that are inching towards Southern Oregon a little bit. These are some wonderful, wonderful folks doing excellent work. And I just wanted to give a huge shout out, especially to these trans advocates in rural communities doing this work, because it is hard. It is really, really hard. And these people are tremendously brave and brilliant. And I am just so grateful to each and every one of them. Next slide. I just want to leave you with a couple of quotes before we close. There's important wisdom in how LGBTQ communities have navigated community building and support in response to past pandemics, such as HIV and AIDS. We can learn from their histories of community resistance and resilience. And next slide. This one I love very much is every breath a trans person takes is an act of revolution. And with that, thank you all very much for listening. And if there are questions, I would be happy to try and answer.
Thank you so much, Beck, for sharing all this information with us. While our audience writes down comments and questions, let's go over some things to remember. First, we will email you the CME and CE certificate instructions and our YouTube link today. Please remember to claim your certificate to complete the program evaluation. It will take just a moment and will be of great help to us. Keep in mind that the activity code expires in 1 week. And remember that webinar is being recorded and you'll have the video available on our channel. We'll send you the link. And if you have any questions after today or a question that we don't get to answer, feel free to send me an email and I'll make sure to contact Beck and get your answer. Now the activity code for today, it's on your screens. You can either go to the website and enter the code or use the QR code that you see on your screen. We do have a question. It's from Brittany. It says, I'm non-binary and I use the terms you guys and thanks man in my personal life, whether I'm speaking to males or females, as a way of breaking down the binary. Is this offensive?
That's a really good question. And my answer is maybe. So language use and what is offensive to people is totally subjective. If the group of friends or people that you're with are comfortable with that language, then that's fine. If it's an established thing that's okay language to use. I know that like in my trans community circles, if I'm around trans women, I would not personally say the phrase you guys or hey dudes or whatever, because I know that that's hurtful to those people. But we've also established that and clearly communicated that with each other. So I guess it's about having kind of that open communication with your friends or your colleagues or whoever you're with, where you kind of check in about that and ask. Because I grew up too kind of thinking that like guy and dude were sort of like in a way gender neutral, even though it's quite gendered language. So I definitely get where you're coming from. But I would check in with the people that you're around, because sometimes you never know what language might be harmful or hurtful to somebody.
Thank you.
And that I will note super quickly too, that also goes for the word queer, where that's like super, super accepted and cool in some LGBTQ plus circles, and other people really don't want to be called that. So it's about checking in.
Thank you. So we have a lot of comments and things and wonderful and useful content. Thank you so much. Kudos for the presentation. I don't see any more questions, but keep in mind, if you come up with any question, feel free to send us an email and we'll get it sorted out for you. Thanks to our speaker for sharing their time and knowledge with us. We really appreciate you. And thanks to all of you for participating today. Now you have completed the session and you may disconnect. Have a wonderful day. Goodbye.